So why are you still feeling dizzy even though you're taking medications for POTS? It's a really good question. And there's always a trade-off, right? So if we're taking a medication, usually that's to deal with a symptom that you have, right? So you're getting tachycardia, maybe you can take something that helps to decrease your heart rate, but does that solve the underlying problem? That's the big question we've been getting after. And that's what we've seen bear out in testing with people. So we actually see sometimes if we put people on a tilt test and maybe they're still on their medication, propranolol, midodrine, fludrocortisone, and we may see that even on those medications, they still test for things that are positive, like they still may have reactive hypocapnia when they're orthostatic, or they may still have changes in cerebral blood flow. And these things are really important because that's part of the trade-off. One of the things we hear very commonly is propranolol really helps me feel less anxious, less revved up. But then it also doesn't solve the problem of cerebral blood flow. So how do you use these things together, or how do you start to solve this problem in a way where maybe medications are useful, but we can still solve the underlying problem underneath it? Or sometimes we may find that they stand in the way and we actually need to find an alternative route to be able to help people. So just a way to think about it. But if you're still feeling dizzy or lightheaded while you're on medication, that may be an indication that you're not solving the underlying problem.